we're crying every day when every month when we hear these numbers.
165 British Columbians died of a suspected overdose in the first month of the year, making it the deadliest January on record. This devastating number follows the deadliest year BC has ever experienced when it comes to the overdose crisis.
At this point, it's becoming the norm. And that scares me, frankly.
Leslie McBain with Moms Stop the Harm was horrified when she learned that about 5 people a day died of a drug overdose in BC in January.
I felt it myself. I lost my son to a drug overdose 7 years ago. And, it never goes away.
Because I just got my dose 15 minutes ago, the machine regulates my ability to get another dose for at least 2 hours.
This opioid dispensing machine has been used in Vancouver's downtown east side for a little over a year now. Doctors prescribe an opioid for users they know will likely risk their lives by turning to a possibly poisoned supply. The machine only carries the legal pain-killing opioid, hydromorphone.
People really appreciate just the autonomy, getting up in the morning and coming and getting their medications.
The federal government announced Tuesday nearly $3.5 million is being invested to expand the Safer Supply project. 4 more of these machines will now be placed across Canada, including one in Victoria and a second one in Vancouver. But creator Dr. Mark Tyndall doesn't feel it's anywhere near enough.
Right now, they tend to be in, large urban centers, and I think they're even more suited to places where they don't have very much happening with harm reduction on the whole, and they still have a lot of overdoses. And I think this solution would be even better suited to those kind of places.
The machines can provide medication for up to 48 people. Of the approximately 20 people registered with the pilot project in Vancouver, 2 have been able to get into recovery and no longer use drugs. And Dr. Tyndall says others have been able to reduce their use.
The biggest benefit of this, besides preventing people from dying, is that people have time to get kind of their life back a little bit.
The city of Vancouver continues its efforts to decriminalize simple possession in the city. It's now submitting a preliminary application to Health Canada outlining its Vancouver model to substance use, with a health-focused approach aimed at recovery, not jail time. McBain feels quicker action is needed on every level of government.
There's initiatives that can be promoted and implemented, but it just takes forever.
In New Westminster, Ashley Burr, City News.